This week, Dr. Charles Vilfort will be talking about Greek civilization. Greek civilization could be divided in two periods, the archaic and the classical one. But both of them were dominated by art, philosophy, politics, and entertainment or sport. But the difference is the classical one had more sophisticated architecture. During that time, we have a lot of domination, and it was different small cities, small group in Greece. For some people, Greece civilization is considered as the cradle of civilization in Europe. During that era, we have a lot of great scientists such as Pythagoras, who is known for his theorem in geometry to look for the hypotenuse. We have also Aristotle, who is considered as the father of zoology. Let's go now to Archimedes, who is known in physics for his theorem, who said whatever body you put in a fluid will go upward because of its weight. Greek civilization couldn't be separate from Greek medical practice. And when we are talking about Greek medical history, the first name who come to our mind is Hippocrates. Hippocrates was born in 460 before Christ and died in 370 before Christ. Hippocrates didn't go to school to learn medicine. He learned from his father practicing medicine. But Hippocrates was able to create a school in Greece. Also, Hippocrates was able to write a lot of books in medicine. He was the one who invented a lot of medical terminology, and we are still using them until today. For example, acute, chronic. Hippocrates was the one who came with a lot of mental disorders such as epilepsy, panic, mania, etc. But out of his corpus, what is known as Hippocratic corpus, where we was able to see like 70 books. They said he was able to do that with helps of other people who work at the med school. He had also the Hippocratic oath. For some people, it was there before, but he was the one who get credit for it. Hippocrates believed in nature, and he said when someone was sick, it was because of loss of balance because between the four humors. When we talk about four humors. They are blood, phlegm, yellow, and black bowels. During the Greek medical practice at that time, at the beginning, before Hippocrates arrived, they used to believe in incantation, religious stuff, because for them it was God punishment or devil punishment. But with Hippocrates, who believe if someone is sick, it's because of the nature. We have to look for his treatment. And this is why Hippocrates wrote his Hippocratic oath just to protect the doctors. And the doctors were supposed to practice medicine and use their knowledge as much as they can without doing any harm to patient. But one of the theory they have at that time, it was if you have a healthy mind, you will have healthy body. And we are talking about time before Christ. And they were able to recognize if someone practice sport and gymnastic, they will have an optimum body function. And that way, they will keep a good harmony between mental and physical body. Hippocrates was known for a lot of realization in medicine. He was recognized for looking for history of medicine to be able to diagnose and treat a patient. We can keep talking about Hippocrates' medical apport in the modern medicine today, but we have to say Hippocrates was one of the first one to recognize medicine should be separate from superstition, but he wasn't the first. As a reminder, Imhotep, who was years before him, said so. Time to stop mixing superstition with medicine. But before we leave, we would like to remind you, medicine has been changing from time to time, and it will continue to change. The Hippocratic oath at the beginning was pronounced by heart to show respect to Greek gods and to show their interest to practice medicine based on their knowledge without doing any harm to patient. But today, a lot of med school, they don't pronounce that Hippocratic oath. Some of them will give some copies to graduate, but others just mention it. Regarding that Hippocratic oath, one of the first changes or modification was realized in 1948 in Geneva, and the last one was done in United States in 2017. That means that will continue to change. Before we go, we would like to remind you medicine has been changing and will continue to change because they have to adapt to the era where we are living. Until next week for another presentation by Dr. Charles Vilfort.